The access to primary care was not great in the Houston market. People didn't have venues to get care, and so a lot of times they resorted to emergency care.
We have the largest number of uninsured patients in the country, and as a result, we see people who put off taking care of their health.
We have a lot of people who use 911 for their primary care, and they lean on the ambulance and the emergency department to get the care that they really should be getting in a doctor's office. The EMS system is somewhat burdened by that because our emergency medical services system is designed really to do emergencies. It's really not designed to do primary care. Using technology is going to make healthcare far more efficient.
Telemedicine actually started at NASA back in the 50s. We had the need to provide health care at a place that may or may not have a physician. And so we used technology to solve that problem. So now we can use that same technology, now packaged a little bit differently to do the same thing.
We're calling it the ETHN project, and that stands for Emergency Telehealth and Navigation. Firefighters, the EMTs, paramedics will go out on scene. They will do an initial screen, and if they think that this is someone who has a low acuity or a not dangerous problem, they will then connect using telemedicine techniques. If the doctor says, you know, I need to see this rash, the firefighter or EMT paramedic will be able to move the handheld computer, be able to move it around to show the doctor the rash.
I can speak directly to the patient.
Just as if they were in the emergency department.
The biggest solution for ETHN, one of the biggest innovations, is really pairing these patients up with both primary clinics, medical homes, as well as pairing them up with healthcare navigators and social workers through a different program that already existed in the city of Houston. Putting this team together has been very challenging. So trying to pull people from different fields and trying to pair programs that previously didn't work together. We were all sort of aiming at the same problem, but not necessarily addressing it in a way that worked well together.
ETHN will hopefully divert some of these people into a more appropriate setting for their health care so that hopefully they won't have to call 911 in the future.
Before, we would connect with patients, and a lot of times we didn't know what to do. We both agreed that the patient didn't need to go to the ER, but we didn't have anything to connect them to the right treatments. This helps us connect them to a clinic, some type of other treatment besides just going to 911 or to the ER.
ETHN just gives us one more avenue to get people, hopefully earlier rather than later, into healthcare.
We're going to be able to make huge differences, not only in healthcare, but in all aspects of life.